Today I'm going to talk to you about knee pain. Now the knee is a very complex joint and there's a lot that can go wrong with the knee. Thankfully most of that is fairly superficial and fairly fixable, but today, because the knee is a very complex joint, what I'm going to do is give you a general overview of the knee pain, what the knee pain means, and then I'm going to do videos in the future that cover more specific knee problems. So what we've got right here is a model of a left leg. So this right here is the outside of the leg, and then you've got the inside of the leg here. So obviously this is the front, this is the quadricep muscle that you see coming down here. And what you're looking at is the kneecap is just here. You can kind of just see the protrusion. So as the quadricep comes down, you can see it goes from red to white. So that's where the muscle turns to tendon. And then it comes down over the knee joint and attaches to the front of the shin bone, so the tibia. Within this tendon is the kneecap. So the patella is housed within that tendon. So if you were to take that tendon off, the kneecap would come with it. Now, a lot of the time when people come into clinic, they have pain at the front of the knee. This is one of the more common areas to have knee pain. So the reason for knee pain at the front tends to be tenderness. So either just above the kneecap or just below the kneecap. And generally speaking, this results from too much tightness within the quadricep or overuse. So for example, someone's gone and done a lot of exercise in the gym and that's caused a lot of strain through the tendon. Eventually that has led to inflammation and caused some sort of tendonitis or tendinosis. So pain at the front of the knee tends to be more tenderness. If we go towards the inside of the knee, you've got muscles coming down. So you've got the adductors, you've got this long muscle here, the sartorius, all coming down and attaching to either the inside of the thigh bone, so that would be the adductors, or you've got the sartorius coming down attaching to the inside of the tibia, so the shin bone. And then just behind that, you might just be able to see, is where the hamstrings attach. So when people come in with pain on the inside of the knee, that tends to be, again, more of a tendon problem. So that could happen as a result of too much sitting cross-legged. That could happen as a result of something more repetitive, such as walking, cycling, running. Sometimes hamstring work can cause pain on the inside of the knee as well. So if you have pain on the inside of the knee around here, so just below the joint line on the inside of the tibia, then it tends to be more of a soft tissue problem, and the solution to that is to reduce the tension, reduce the load that's going through it, reduce the repetitive nature of the movement, and that will naturally get better on its own. Now, if we move deeper into the knee, you can't see it on this, but there's a lot of ligaments. Well, you can kind of see it here. So there's a lot of ligaments around the knee. One of the main ones is the medial collateral ligament. Now, this kind of holds the two bones together, the femur and the tibia. And this will usually only be damaged through trauma. So for example, a fall, or you've had an impact on the outside of your leg, which has forced your knee more inwards, causing a stretch through that ligament. So people with pain on the inside tends to be more tendon unless they've had some kind of impact. Now, as we go deeper again, we've got the meniscus that comes on the outside and the inside of the knee joint. And again, this just helps to create stability and motion through the knee. This can often be irritated through, again, repetitive movements or trauma. So forces on the inside or the outside of the knee can cause sort of tearing through that meniscus. Now, as we move around to the back of the knee, we tend to see less pain through the back of the knee, but it can still occur. And as you can see, we've got the gastrocnemius, so this is part of the calf, comes up and attaches to the back of the femur. So it crosses over the knee joint and attaches just in here. So if someone has done a lot of calf related work, so let's say sprinting or jumping or even just direct calf work in the gym, then that can cause irritation through the attachment points up here. In older adults, say adults with arthritis, you can sometimes get something called a Baker's cyst. So this is where the fluid from within the joint itself has become sort of pushed out of the knee and has pooled and become bigger, like a bit of a balloon. So anytime you bend your knee, that can cause pain. So this is more common with individuals with arthritis. There tends to be not much that we can do in terms of treatment for that. So it's more maybe steroid or anti-inflammatory injections. Now, as we move around to the outside of the knee, now we can see, again, there's a lot more tendons through here. So we've got the hamstring tendon attaching just to the sort of outside and the back of the knee. As we move slightly more forward, we've got the IT band. So this big, thick white band that comes down here, attaching to the outside of the knee. This is a very common area for people to get pain. And unfortunately, what a lot of people are told is that they need to roll on their IT band. So do a lot of foam rolling or soft tissue massage work. If you do have pain on the outside of the knee, I've already got a video about IT band pain. So I suggest you go and watch that. So this IT band, if this is too tight, it causes a lot of tension through the outside of the knee. That can cause rubbing, that can cause inflammation. So you can get kind of tendonitis on the outside of the knee as well. As we go deeper in, you've got ligaments. So we've got the lateral collateral ligament. This is also more commonly damaged with trauma. So if you've had some kind of impact from the inside, pushing the knee out, that can cause a stretch through the knee. So that can cause strain, that can cause pain. And again, as we go deeper, again, we've got the meniscus, which can get torn. That can get torn through trauma, or poor body mechanics. But generally speaking, when people come in with knee pain, it tends to be more towards the front, and it tends to be either above or below the kneecap. Again, as we go even deeper into the knee, you've got the joint itself. So this would be more sort of an arthritis. So if I just take this apart, as we look at the underside of the knee, obviously, forget these two metal prongs. They are not there in you. But this blue surface here is the cartilage of the knee. So this is the bottom side of the femur. So this is your thigh bone. This blue surface here is the cartilage. Now, for younger adults and children, this is nice and smooth. This is moving very well. And this allows free movement within the joint. But as we get older, and as we have more impact or more trauma through the knee, this can wear out. So this can become more arthritic. So this surface becomes more rough and it exposes some of the bone, and that can cause a sensation of grinding, clicking, or crepitus, we call it. It can cause some discomfort. Tends not to be painful directly because of the joint, but any inflammation around the knee can cause discomfort. So there's plenty that can go wrong with the knee. Most of the time it tends to be soft tissue. But what I'm going to do is make some more videos specific to certain knee conditions. So I hope today's video has been helpful. Hopefully it's given you a good idea of what can go wrong around the knee. So if you have pain, let's say at the front of the knee, maybe you've got a better idea now of what's going on. So now you just need to figure out what to do next. And that will come in a video very shortly.